Hi, my name is Naomi, and I just want to respectfully acknowledge that I'm joining you all from the unceded and unsurrendered territory of the Algonquin and Anishinaabe people. My presentation will provide a brief overview of the work that I was able to do during my practicum with the Nurse Family Partnership Program, which is within the Population and Public Health Division at the British Columbia Ministry of Health. So just quickly what I'll be discussing during my presentation, I'll explain what is the NFP program or Nurse Family Partnership. I'll get into how it is an evidence-based program, and then I'll explain how data collection is a really important part of the program. And then I'll discuss the work that I was able to do, which was updating the nursing assessment forms and the final outcomes of my project. So you're probably asking, what is the Nurse Family Partnership Program, or I'll be referring to as NFP. So the NFP program is a licensed program that was initially started in the United States and has since been replicated and implemented into public health programming into countries around the world, including Australia, Ireland, Scotland, Norway, and of course, Canada. The program supports young first-time mothers and their babies who face intersecting social and economic inequities, and they're supported from the time they find out they're pregnant until the child is 2 years of age. The BC Ministry of Health implemented the NFP program as a way to enhance their perinatal services and to better support the subpopulation that faces a lot of systemic and structural barriers. The program's main inputs are the highly trained public health nurses that work to create therapeutic relationships with program participants by meeting them weekly throughout the course of the program. And they support their current needs, whether it's related to their health, income, housing, employment, or education. And they do so by providing empathic support, health education, system navigation, and child development assessments. So one of the unique aspects of the NFP program is that it is an evidence-based program and has been studied with the help of randomized controlled trials. Part of the licensing agreement when a country wants to implement the NFP program is that they have to conduct a randomized controlled trial. So there's been many studies that have been completed in countries around the world throughout the years. Sorry. The NFP program has 3 overarching goals. So it's to improve pregnancy outcomes, improve child health and development, and improve families' economic self-sufficiency. So under the 3 goals, I just put a few of the positive outcomes that have come out of some of the randomized controlled trials. So NFP has been proven to reduce low birth weights, reduce childhood injuries, reduce maternal incarceration, and even more that I couldn't fit in this slide. Data collection is a really important part of the NFP program. Data is collected annually as a way to assess the many outcomes that were had during the past year with the program, making sure that the program is achieving the goals of the NFP that I touched on in the previous slide, and to assess for any gaps and limitations. Because NFP is implemented in countries around the world, data collection is really important in order to assess that the program is properly supporting this, the population in which the program is implemented in, or the country that the program is implemented in. Beyond doing program evaluation, using the data to do program evaluation within the NFP program, the data could be used to support upstream policy work that would go beyond the NFP program and help to address some overarching or like systemic inequities. So now I'll get into my project, which was updating the nursing assessment forms. The nursing assessment forms are what the public health nurses use to do their documentation and their health assessments of program participants throughout the course of the program. They hadn't been updated in almost 10 years, and they were found to lack a lot of relevancy. So I was tasked with updating 2 of the forms, one being the health habits form, which assesses for substance use, and the client intake update form, which assesses for social and economic backgrounds, so income, housing, education, employment, family relations, things like that. So I started off my methodology by figuring out a plan that would best update the forms in the way that would be evidence-based, and to make sure that we were better able to capture the current social health and economic inequities that residents of BC were currently facing as a way to enhance and improve the forms. So I firstly looked at the internal documents that are available for countries that have implemented the NFP program. and was able to get a better understanding of all the intricate parts of the program and all the supports that were provided. And next, I looked at the previous annual report. So this is the kind of format that NFP uses as a way to analyze the data yearly. So I looked at the previous ones are completed and assess for any gaps or any changes that could be made in the way that data is collected from the specific nursing assessment forms. I looked at the ministerial mandate letters, so the one from the BC Ministry of Health and the BC Ministry of Mental Health and Addiction, as a way to kind of guide and understand like the direction which the ministry is going, and to understand like the current issues that residents of BC may be potentially facing. Next, I did an interjurisdictional comparison, which is like a big fancy word to just say that I looked at the versions of the Ontario documents that were recently updated and the international nursing assessment forms that were also recently updated. One of the unique parts of the NFP, or one of them of the new parts, is that you can compare, the countries kind of work together a lot. So you can use a lot of the resources to compare annual reports. And in this case, I got to use the nursing assessment forms. And for the BC randomized controlled trial, the results are currently under peer review and the final study will be published later this year. We do have access to the tools and validated scales and questionnaires that they use. So I tried to incorporate that as the randomized controlled trial in BC. We'll use as kind of the baseline and how to improve the program going forward for both BC and the Ontario NFP program. And then next, I completed a gap analysis. So I looked at what other things could be changed, looked at more validated tools and scales that could be incorporated to be used as further nursing assessment, and also as a way to collect data that would be like in an objective way. And then lastly, we did a lot of stakeholder collaboration with the supervisors of the regional health authorities. So they're the direct supervisors of the public health nurses. And they were able to give us a lot of feedback on how to update the forms so that they would be updated from a nursing assessment perspective. Final outcomes of my project, we did a lot of work to update the forms, and I really couldn't fit everything that we changed in like 7 minutes. So I just put some things I thought would be interesting to highlight. We try to update the language so that it would be trauma informed and have a harm reduction approach in the way that their nurses were conducting their assessments and that the data was being collected. We also expanded the interval timing for some of the forms because the nurses complete the forms at many times throughout the course of the program. And if they weren't able to complete it during a specific time, which was like a month interval, they would often skip it, leading to gaps in data. So we expanded the interval timing as a way to increase the amount of data available and to allow for more time for nurses to complete their assessments. We updated substance use assessments, so particularly around vaping and cannabis use, which was found to be pretty outdated in the previous versions of the forms. And we enhanced measurements for housing inadequacy and instability, as that was also not available in the previous forms. And there's many ways in which someone could be deemed to be housing inadequately. So we were able to add questions so that nurses could complete a more comprehensive assessment, and that more enhanced data could be collected from that. Yeah, thank you so much for listening. And I just want to also thank Chelsea, who was my supervisor during my practicum. And thank you all for listening. And I'll answer any questions you may have during the session.